Good afternoon. In recent days, we've seen a significant rise in COVID cases here in Jersey. When we spoke to you during a press conference on Sunday, the 4th of July, we shared new guidance for direct contacts, and we explained then that the changes to our isolation rules would lead to a rise in cases. And that is what has happened. Now, as I shared in a video message last night, I know that this rise will be making some of you feel concerned, but please let me reassure you that whilst this is a developing situation, it is one that we are monitoring very, very closely. The pandemic has been and continues to be managed in a way which is proportionate to the risk, and at all times we are mindful of all the impacts and consequences. And STAC and public health officials and competent authority ministers all met yesterday to consider the measures that we have in place and the collective well-being of islanders. Following these meetings, we are updating our guidance and extending measures to keep islanders safe this summer. So following the increase in cases of COVID-19, ministers have agreed a further pause to stage 7 of Jersey's reconnection roadmap until approximately the 5th of August, when a decision will be made based on the latest position. Ministers had every intention to proceed with the remainder of Stage 7 reconnection, and it is with regret that we're not in the position to enable full reconnection at this point in time. But it is the right thing to do. We had originally agreed for an additional 10 days to allow for more islanders to receive first and second doses of the vaccine. And whilst vaccination rates are increasing day on day, we are also seeing increased cases, especially in younger islanders. And whilst we're seeing cases of COVID-19 increasing, our focus is repositioned in the context of vaccination coverage, with our hospitalization rates and risk of severe illness remaining low, which is the position we must maintain this summer. So that we therefore should not risk reopening high-risk settings such as nightclubs, where we know COVID-19 is more likely to spread amongst the younger, unvaccinated population, and then potentially, which is the risk, into our more vulnerable islanders. So ministers will continue to review the current position and work with STAC and public health to provide an update when we can. To mitigate the spread of COVID within workplaces, protect workforces and to ensure business continuity, ministers are also advising islanders to continue working from home wherever possible. If you're unsure of the specific rules regarding your workplace, please speak to your employer. And we're also asking employers to consider what you can do to help prevent the spread of COVID within your workplace. We would like employers to take any operational measures they think is appropriate to limit the spread in their workforce and in the island. At the same time, everyone should be thinking on how to keep workspaces clean and well ventilated, and ensuring you and your colleagues practice the enhanced hygiene measures we are all familiar with. Now, I know that the last few weeks have been particularly challenging for our schools, and I would like to pay tribute to all children, young people, their parents and carers, and all our school, college and nursery staff for their extraordinary efforts this year, and especially at this challenging time. Over the last week, we have listened to concerns by parents and staff working with children and young people, particularly younger members of staff who haven't yet had the chance to be fully vaccinated. So as a result of this, we have issued new advice today to schools and colleges for their final few days of the academic year that makes it clear, for example, that children should not attend school if there is a COVID case in their home. And this would include if a parent or carer or sibling of that child or young person or anyone living in their home has tested positive. Head teachers can also make a decision to close a class or year group until the end of term if there is a likelihood of rapid and widespread infection occurring, resulting in the further and significant absence in both children and staff. Online learning will be provided. This doesn't mean that children should be isolating in their rooms if they are not in school. In order to ensure their mental health and well-being is supported, they should be able to enjoy fresh air outside with adult supervision where possible under the current public health guidelines. The Sites Department will continue to meet with STAC and public health colleagues, head teachers, the Children's Commissioner and trade unions to work on the plans for a safe and sustained return to schools and colleges in September. And I'll now pass over to Deputy Richard Renouf as Health Minister. Richard.
Thank you, Chief Minister. I know the delay to the Stage 7 reconnection will be frustrating to some islanders, but this pause will provide valuable time to further roll out our vaccination programme, which will ensure as many islanders as possible are fully vaccinated and protected from COVID-19. Our latest figures show that 57,000 islanders have now been fully vaccinated, with a further 15,000 islanders having had their first dose. And as we've said many times before, getting vaccinated is one of the most important things anyone can do to protect themselves and those around us from COVID-19. Whilst it won't entirely stop the spread of COVID, the risk of becoming severely ill is reduced significantly, and our low hospitalization rate is testament to that. Pausing the Stage 7 reconnection will mean that even more islanders are fully vaccinated and have that important layer of protection against the effects of COVID-19. At the same time, we're also reminding islanders of the importance of adhering to public health prevention guidance. This includes a strong recommendation for the wearing of masks when in indoor public places. Masks remain mandatory for islanders over 12 years of age when using public transport or inside the bus station, the airport and the harbour. But in other places where masks are not presently required by law, we're encouraging islanders to wear a mask in places where physical distancing is difficult. Ministers have also decided to provide new public health guidance to direct contacts. Earlier this month, we announced that islanders who are direct contacts would not be asked to isolate if they're taking part in the testing programme, and this won't be changing. However, we want to urge those islanders who are direct contacts, especially if you have a positive case in your household, to think very carefully about the activities you undertake and the settings you visit. If you're waiting for your second or third negative test result, please work from home if you can. Don't attend an appointment with your dentist or GP unless it's urgent. Try to minimize social contact and avoid busy or crowded public spaces. We're also asking all those who are direct contacts to avoid visiting patients in the hospital or residents in care homes unless there are special circumstances where you need to do that. If you can stay home, please do so. And if you feel unwell at all or begin to show any symptoms of COVID, you should call the helpline immediately. Please don't call the helpline, though, if you think you might be a direct contact. Our contact tracing team will contact you directly. Please take care, but be patient, as we will be in contact with you if you are identified as a direct contact. We all have a duty to one another and to our wider community. Please be safe and act responsibly, whether it's taking that extra time to use hand sanitizer or ensure your hands are washed thoroughly, or thinking about the ventilation of your home when you have visitors. We must keep our guard up. Many of the worst effects of COVID-19 have been mitigated, and we do now have a strong layer of additional protection in the form of our vaccination programme. Please keep doing your part to keep your colleagues, your friends, your family and yourself safe. And I'll now hand back to the Chief Minister.
Thank you, Richard. I know that the delay to stage 7 reconnection will be disappointing to a number of islanders, but it is an important pause which will allow us more time to vaccinate younger islanders. The vaccination programme has proved incredibly important in protecting more vulnerable islanders and those over 60. This has been demonstrated in the current rise in cases, as although all age groups have seen an increase, there's been a marked distinction between the rise in cases amongst older age groups and the much sharper increase in cases amongst younger age groups. So we are seeing a rise in cases, and we mustn't be complacent, and I hope that islanders will appreciate that our announcements today strike a balance between the increase in people testing positive, but also the reduction in severity and lower hospitalization rate that we have seen in recent weeks. And I also want to echo what the Health Minister has just said. We all have a duty to take personal responsibility in our actions and to limit the risks that we take. So taking that extra time or thought, that added precaution, might make all the difference to keeping not only yourself, but also those around you safe. So thank you very much for listening so far, and we'll now take questions from the media. Okay, so hopefully we have Islin online, Harry online, and Tom online, which is ITV 103 and JP. And then in the room, we've got Freddie somewhere over there, and Julian from Bailick to the left. So, and we'll bounce in and out of the studio onto online. So we'll go for Freddie first, and then we'll go online, and then we'll come back and probably end with Julian.
Thank you, Chief Minister, Health Minister, Dr. Ivan Muscat. Freddie Miller from BBC Jersey here. Chief Minister, to you first. Exactly 2 weeks ago, on the 29th of June, you said in the States, the view at the moment is that introducing a mask is unlikely to impact upon the present wave that we're seeing. Now, of course, we are being encouraged to consider the benefits of wearing masks out and about in public again, which, of course, never went away, but you're pressing it much more strongly, despite a few weeks ago saying you didn't think there would be a benefit. Further to that, on the 4th of July, last weekend, on that Sunday evening when we were called in here, in response to one of my questions, you all said that children identified as direct contacts should categorically go to school because that would be the best place for them. Now, of course, you're saying children shouldn't go to school if there's a COVID case in their home and they're likely to be a direct contact. Now, these are just a few examples of things that have changed in recent weeks. I appreciate it as a fast-moving situation. But given all of this, do you firstly regret some of the things that were said a couple of weeks ago? And secondly, do you understand why some of your recent messaging has been described as inconsistent and, frankly, a shambles, as we've heard today?
Well, I know, using that last word first, that there are certain politicians who would like to make every political play they can, and to be honest, that's not particularly helpful. So in relation to, I think that word was used, and I've heard others around, for example, contact tracing and things like that. Can I just, again, absolutely place on record for the teams who are doing all that contact tracing, all the testing, what a fantastic job they are doing. And I hope I've said that previously, but I just really, from point one, they've had a lot of pressure. We've recognised that. We are putting more resource in there, but they are doing a really, really cracking job, and hopefully they will continue doing so. Now, going back to the issue around the issue overall, context we're in, it is a fast-moving position, and I think what I hope islanders recognise, we're trying to take that, I would hope, a responsible position of saying, look, numbers are going up, and what we want to do is to start applying a gentle brake to that acceleration. The context we must remember is that we are actually testing, we've said it previously as well, I think last week was around 19,000, if you include lateral flow. That's almost double the UK rates. I think we've also said it's about 3 times that of France, I believe. This week, we are projecting doing 30,000 tests. And so that context, which is part of the overall picture, is similar to what we were saying in November, December, i.e. the volume of testing that we're doing will greatly magnify the positive results that we're going to track down. That's not the only issue, but that is one of the factors that we're bringing together. And so what we're saying is actually, look, we can see we've got a kind of advance warning here that we need to slow that acceleration if we can. And that's why we're taking the measures today, emphasising the personal responsibility, emphasising it, if you like, around being sensible. And obviously there is still that balance which we are trying to retain between very, very strong advice and going backwards into mandatory territory. It is, again, different to the previous two occasions when we've had these surges coming through, these waves coming through, because it's about the very good vaccination rates. And again, as I think Richard said in his speech, the fact that we're going to be, hopefully by mid-August, so about 4 weeks away, I think it's 80% of everybody should be double vaccinated by that point. So it's just that balance of getting through that process. Now, in terms of dealing with the direct contacts, don't forget, the week we are now in, there are Wednesday and Thursday, there are 2 days left of term. So therefore, in the context of those last couple of days, we do think it's prudent to put the messaging through versus the context of that slightly longer stretch of every day is important, that's been said a number of times around the education situation.
I mean, just to pick up on that, I fully appreciate everything you've said, and I'm sure Islanders will completely understand the rationale behind it. But do you accept that by saying one thing not that long ago and now saying something that's kind of contradictory, albeit slightly not, is just maybe a bit confusing, and you have got people who do feel a little bit lost now? I
think what we have to recognise that the circumstances change, and we will respond to those circumstances. So we're not deliberately going out and sending one message 2 weeks before and a different message. It is a nuanced message, which is basically saying that actually it depends on the circumstances. It's specifically around children who have got a positive contact in their household, as opposed to the kind of wider context, which could have been they were a direct contact, but there isn't somebody positive in their household. We have refined that message, if you like, in the context of basically 2 days left to go until all the schools are broken up. Do you want to go for your second question?
Thank you. Yes, if I may. Could you just categorically state whether or not we are aiming for herd immunity in Jersey?
On that point, I'd definitely hand over to Ivan in terms of the context.
We are not deliberately going out this summer to achieve herd immunity. But we are, as our major sort of strategy behind all this, aiming at some point to reduce COVID to an influenza-like burden. And to do that, it does mean that through time, a number of people will have had some exposure to COVID, either in the form of vaccine, and we hope that will be the vast majority, or through natural infection. And that will then reduce COVID to an influenza-like burden, which causes some pressure, but not the type of pressures we are seeing now.
If, to play devil's advocate, people were to respond to what you've just said by saying that sounds like herd immunity, but just without calling it herd immunity, what would be your response to that?
My response will be almost a repetition of my previous answer, because that is actually what we have in mind. We are not trying to push infection through the community in order to achieve herd immunity. We are not playing that game. That approach had actually been used, I think, in Sweden at one point, where they shielded the vulnerable and went for herd immunity. This was in the complete absence of vaccination. And in retrospect, they found that the burden of disease they had to manage, together with the effect on the economy, was worse than in surrounding Scandinavian countries that have a similar culture and therefore are immediately comparable, if you like. So we are not going down that road. It is true to say, though, that if some people cannot be vaccinated, and I'm talking here primarily about young children under the age of 10 who at the moment are not going to be vaccinated unless they're very, very vulnerable. And at the moment, secondary school children aren't being vaccinated either. Then if infection were to occur in those age groups, it is better for them to have infection in summer than in winter, where there will be co-circulating influenza and RSV adenovirus and other winter respiratory viruses. And the last thing you would want is for people to be co-infected with different viruses at the same time, or for there to be an overlay of different viral illnesses putting pressure on the health services as a whole. So in a sense, summer is better for certain for COVID than winter, but we are not taking the opportunity of using summer to drive that. That is happening, if you like, naturally. Bearing in mind, finally, that over the last 2 or 3 months, there has been a very significant and understandable pressure from the people at large saying these restrictions are getting very burdensome. We are suffering as a result of this at a number of different levels. Please ease these restrictions.
Okay, thank you very much.
Thank you. Islan.
Hello. On Friday, in recent numbers that we've seen, over 200 of the then over 900 cases, positive cases, were double jabbed plus 2 weeks. Is that according to expectations? And what's the evidence so far in terms of how illness is manifesting itself?
I think, Ivan, do you want to?
Thank you. So the vaccine is considered to have an efficacy of up to 80% against symptomatic COVID infection, which means it doesn't cover 100% of COVID infections, but prevents symptoms in 80% or up to 80% of cases. However, it also reduces the severity of disease and hospitalization by 96%. And it reduces mortality by 98%. So vaccine efficacy isn't just measured in relation to symptoms, but also the more severe effects of COVID. And that is in keeping with the way vaccines work in relation to other infections as well. The 200 or so cases who had infection due to COVID, despite having 2 vaccines plus 2 weeks, have in the main, of course, remained in the community without severe disease and are simply, if you like, managing a flu-like illness rather than the type of illness that we used to see in the second and first waves of COVID.
Second question.
Okay, and on that basis, I think if I can just, as a supplementary, are you able to give us any information on the 5 in hospital then, in terms of their vaccination status at the moment? What comfort can be taken from that?
5 is a rather small number, and that is the number we have in hospital at the moment. But since the 28th of June, we've had 10 cases in hospital, and if I may give a breakdown of the 10, that may be more prudent. So of those 10, about half had been fully vaccinated, half are above the age of 50.
Okay, do you want to go for your second question?
Yeah. My understanding was from the briefing we had this afternoon as well, was that cases are, although they are for the majority in the under 40s, they are also on the up in the older age groups. I mean, what are we forecasting the impact of that to be? We have noted in the past that
as a result of vaccination, more infection would occur in the younger unvaccinated age groups. And the effect of that will be more symptomatic but mild infection in young people, because COVID causes mild infection in the young. But if there is a sufficient number of such individuals, then infection will also be pushed through the vaccine barrier into the more elderly cohorts. And so we are seeing some of that, but as I said earlier, vaccination may not prevent symptoms in all cases, but it certainly reduces severity in the vast majority of cases, in 96% of cases, and reduces mortality in 98%. So we are seeing some of that influx, if you like, of infection into the vaccinated population, but the damage it is causing is limited.
Okay, so if it helps, I think the really simplistic analogy is that a positive case now is not the same as a positive case that we might have had in March of last year, because of the, in general terms, because of the severity in March, April, versus the vaccination performance now. Okay, we'll go to Harry.
Thank you. Good afternoon. There's 2 days left of term, and that's it. And the rules are changing again for children. Has the horse not bolted on this? And going back to Freddie's point, complete contradiction to 9 days ago, and especially children, I'm thinking especially of the vulnerable children who are being pulled this way and that way and told this and told that, and they could be so distressed right now. We've heard about officers going into schools to speak to head teachers. Why haven't ministers been going in to hear the concerns of head teachers and other staff? Because the concerns have been there. And because the information has been so completely this way and that way and changing 1 week to the next, have you got apologies to make to staff, to head teachers, to parents who have been so worried and putting their kids out of school? We've seen that with attendance figures. And apologies to the wider community with how these changes have been affecting them.
Harry, I think you've got to keep this in proportion, okay? There are about 11,000-ish pupils in the school system, primary and secondary. Total active cases as of yesterday is 300. So we accept there has been some concern expressed. There has been communication of head teachers. The education minister, children education minister, has definitely been going visiting schools over the last few weeks, okay, a few days and weeks actually, and he was certainly being briefed on matters yesterday, as far as I'm aware. Whether he went into the schools or not, the point is that communication has been happening. But we do have to keep that in perspective, and we do have to recognise that the context of the last 2 days of school is somewhat different to the context of the last week and a half, 2 weeks of school in terms of educational benefit. And I think that's what we've got to keep in perspective, because I know there's people and individuals who've been trying to make great play of it, which doesn't assist in maintaining the right perspective on this. As I said, proportionality on this is important, but we recognise that particularly with the last couple of days of term left, and usually the fact that it is, not always, but it is usually a wind down at the end of the summer term, that actually it's right then to give that, or if you like, that individual choice to the headmasters or headmistresses to then make their decisions in how they operate those schools in the last couple of days.
Well, we've seen school cases go up over the last few days. Is this not too late? Could you not have done this days ago?
Well, I've just said it's about proportionality, that there, as of today, there are 300 active cases out of about 11,000 pupils in total. So yes, it's one we keep an eye on, but keep it in perspective.
And Chief Minister, if I could add, I think it's always a case of trying to balance the harms, to assess the threat that we are facing, because we, on the countryside, when cases were a bit lower in numbers, we were seeing harms arising out of the mental health of children, being asked to isolate as a direct contact. And we saw very severe harms arising, and we don't want children to suffer a worse harm. So it's all about keeping that balance, and we're constantly assessing it. And I know islanders, we've all had to get used to rapidly changing situations, and that is what we have to do as ministers, and try and come up with the right guidance for the time that we are in. Thank you.
Okay.
Can I just jump in there quickly just before moving to my second question?
Yep.
You mentioned mental health there, but the mental health of children are going to suffer if they're told they're direct contact, they should go to school 1 week, and then a week later, if you're a household case, you're at home. That's going to affect children. They're really going to, a lot of vulnerable people are going to really struggle with, they need continuity, don't they?
We're saying that if you are at home and a member of your household has received a positive test result, then they should stay at home until they themselves have received a negative test result. I think that's the case. So that's going to be a day or two, and that's a safety measure, and that's the right advice for this time in view of the climb in cases that we are seeing.
Okay, second
Okay,
question.
Yeah. Chief Minister, we heard before the briefing we didn't really have an exact date for when you want these final restrictions. You kind of said approximately 5th of August, I think I heard you say. Can you give some more certainty to these businesses? And when can you say that things are going to get better? When can we hope that things will turn for the better once again?
We would all like things to turn to the better tomorrow. And we were very hopeful when we did the original announcements that that's where we were. But the factor that we are very clearly seeing is the acceleration that's coming through, partly driven by the Delta variant. And obviously there seems to have been a combination of events that have pushed that acceleration probably even faster than we were expecting. I do emphasise again, a factor in this is the fact we are testing more. Because as I said, the highest peak we got to in November, December time, although that was excluding travel, or a lot less travel rather, was around between 10 and then we went up to 13,000, and now we're at 19,000. And this week will be, is projected to be potentially 30,000. So that does have an impact on what we're reporting. But equally, the way these, and this is the balance unfortunately that we're having to deal with, is on the one side, which is positive, is the vaccination rate and efficacy, and the fact, therefore, in particular as well, that those who aren't fully vaccinated are generally in the younger brackets, and therefore, even without a vaccine, the impact on them should be less. And hopefully, Ivan will correct me if I get this wrong. But the point is that that's the positive side. But on the other side is that even though the hospitalization rate is significantly less because of the result of vaccination, as those numbers go up, there's a mathematical consequence, which actually we're saying from a prudence point of view, looking ahead at, we're saying it's right to signal that we should be gently braking at this stage just to keep those overall numbers down, and therefore keeping an eye on the hospitalisation side. And in the context of gently braking, it does not make sense to open up, unfortunately, the nightclub, the stand-up drinking and the change in the household gathering side, even with the frustration we'll feel about it, because that actually would potentially be adding to that acceleration. What we want to see are those numbers plateauing down and having a better assessment again of where that all means, what the consequences are. The other bit to remember is that, there, as we've said before, there is no rule book on this. There's no written manual that says if X happens, Y is going to happen. That's why sometimes circumstances change. And also, we are, we can look at certain jurisdictions who may be a week or 2 weeks ahead of us, but the data keeps coming out on a very rapid basis. And so we are relatively at the forefront with having such a high vaccination rate. Within Europe, I think we're about second or third of all the countries. I think Malta is ahead of us, and there's one other. That in itself adds a different facet, if you like, to the deliberations. So there's a whole mix of things in there. But as we said, that's why we absolutely acknowledge the frustration. I can't give certainty on this yet. We would very much like to. But we want to see those numbers just slowing if we can, bearing in mind, of course, the likely uptick pressure might be, for example, as a result of gatherings, as a result of all the football in the last 10 days. That could be a consequence. Those aren't in the numbers yet. So we've got a downward trend, potentially with schools pausing as well, and we might have an upward trend, and we've got to see how those come. So that's why we're taking a prudent measure now, which is signalling to islanders, be sensible, please, guidance, very much guidance on masks. Obviously, it is mandatory to wear masks in public transport. Just remember that, please, still. But actually just re-emphasising the guidance to start signalling that thing about a gentle braking whilst we come through these next few weeks. Ivan, do you want to add anything there? Or Richard?
I don't think so.
No, okay, right. Thank you very much. I think we go to Tom.
Yes, thank you, Chief Minister. We've heard just then about the sort of high ranking of Jersey in vaccination progress, and we seem to be ahead of other jurisdictions neighbouring to us a few weeks ago. But now England, Scotland, Wales are relaxing their restrictions. Guernsey did so several weeks ago. We seem to have made a misstep somewhere. We're out of line. Suddenly we're behind. What's gone wrong there, and why?
I don't like to use the word behind on that front. Actually, before I comment, Richard, do you want to respond? Because I saw your reaction there.
Well, we have, the only restrictions we have are those stage 7 restrictions on nightclubs, bars, and household gatherings, which we are continuing for the time being. But otherwise, I believe we are a very free society, and islanders have appreciated that, appreciated being able to go out for a meal, participate in sports or singing, dancing, whatever. Weddings can now take place. I think we have begun to learn to live with COVID. And what we are saying today is not about introducing new restrictions. There are no legal restrictions that we're announcing today. It's about asking people just to take responsibility, to think carefully about what they're doing. Don't let their guard down. I got out of the habit of wearing masks when I went into shops in the last few weeks. But, it's my responsibility to others around me to start that again. It's not a great onerous burden. And it's those sort of things, it's just thinking about others that we need to start being careful about that, so that we can slow down this rate of infection that we're seeing and arrive at a position where all adults are fully vaccinated, which we expect to be in mid-August, which will be the best protection that we can offer the island. Thank you.
You say that we're not behind, but somebody can go to a nightclub in St. Peter Port tonight, and they can go to one in London next Monday. That was the context for using the word behind, and still can't quite see what's gone wrong. Why are things worse here than given the Delta variants everywhere than they were a couple of weeks ago?
I think the comment I would just say is that we're going back, we're just taking that prudent precaution of not putting the foot on the accelerator further when we're seeing rates increasing. And as I said, there are a whole variety of factors in play which are pushing the pressures for numbers to go down and also numbers to go up. And what we obviously want to see, even though, bearing in mind the context that we've talked about, that in general positive cases should be less impactful on individuals, but we also just bear in mind that there is, it doesn't mean there are no hospitalizations coming down the line. And therefore, if we're seeing an acceleration in the rates, the statistics that we're seeing so far out of jurisdictions is that does lead to an increase in hospitalizations at some point. I think one of your colleagues has already pointed out that we are higher than the numbers we had in December, but also our hospitalization rate is significantly lower. And so, but, as we were saying, it's if the numbers are still going up, and some of those increases will already be baked in. In other words, even if you stopped everything tomorrow, the numbers will continue to increase for the next few days, almost guaranteed. We just want to see how that plays out. That's about a prudent approach, because as Ivan has already also said, is you want to try and make sure you don't land with high levels of infection taking place into going into the flu season potentially. So there is a balance of risks, a balance of harms that we are evaluating all the way through. Ivan, do you want to add anything on that or not?
Certainly, the UK isn't homogeneous in terms of its infection rates. As you know, some areas of the UK have a high infection rate, and they have had to respond to that high infection rate by surge testing, surge vaccination, and other modalities. My understanding is that our neighbouring island has only opened its borders recently, and that controls in the borders there were stricter before, given their different strategic approach to COVID. So there are differences which are evident between the various localities. What our basic strategy has been all along has been to balance the harms between the direct effect of COVID and the effect of the restrictions we employ to manage the risks of COVID. And that requires a fairly dynamic approach and a flux, if you like, between certain activities and other activities as we go forward, constantly trying to balance those harms. And what we're describing today is a rebalancing, if you like, of where we are, given that there has been a slant towards an increase in the number of cases.
Okay, Julian.
Is there a second question?
Oh, that was the second
Please.
question, Nick. Sorry, Tom, I thought that was your second question. Apologies, have I ticked you off too quickly, have I?
Absolutely. Thank you for that. You talked about hospitalisation rates there, and we've heard forecasting today about the number of cases, which could, at a briefing earlier, we were told could reach 500 new cases a day. I'm wondering what the forecasting is for hospital numbers. The reason I ask is that the chairman of STAC said that in the spring last year that 20 to 30 hospital cases would be the threshold for utilising the Nightingale Hospital. That's now being taken down. So given we've got 5 in hospital now, if that was to go up by 5 or 6 times, we'd reach that 20 to 30 number. Is that still the trigger, and should people be concerned by if we get to double figures and we start to approach that number?
Richard, do you want to go first on that, and then Ivan?
No, people need have no concern. We've got good capacity in the hospital. So, for instance, what are we today? Tuesday. So I think yesterday there were over 80 beds free in the hospital. And we must also remember that with the levels of infection we are seeing in the island, some people coming into hospital are tested positive, but they're not being treated for COVID. So they're in there with COVID, but they're having treatment for something else, and maybe COVID is not symptomatic, or it's not something they would need to be in hospital for. So that's an important distinction to remember. Some people may need hospitalisation because of COVID symptoms, but not everybody who is listed as needing as COVID patients in hospital. And the hospital is well organised. We can separate the hot and the cold and ensure that there won't be that mixing, there won't be that risk of cross-infection. The plans are good, and it's important that people still come in to their clinics or when they're required to come in for other procedures that are needed, because the hospital is a safe place to go to. Thank you.
Ivan, do you want to add?
Thank you. So the hospitalization rate has decreased from about 15% in the first and second wave to about 1%. The treatment of cases in the first wave was quite different to the treatment of cases that we would consider hospitalized cases that we would consider now. The ventilation requirements have changed. We've got better oxygenation capacity. And to add some figures to the point the Health Minister has made, of the 10 cases that have been admitted with a positive COVID swab since the 28th of June, half were admitted for non-COVID reasons. So 50% were admitted for particular diagnoses, not COVID, but were found to be swab positive on admission and therefore isolated appropriately.
Okay. Julian.
Thank you very much, Chief Minister. As Tom's just mentioned, I understand there's some predictions that we could reach 500 cases a day by next week. And I know that it's very difficult to predict when those numbers will plateau and even start to decrease, hopefully. So it's likely that we're going to have some high number of cases for some weeks to come, potentially, certainly a significant number. And we're also hearing about businesses that are being forced to close their doors because they can't have enough staff. There isn't enough staff because some are either have tested positive. The co-funded payroll scheme, I know the Economic Development Minister isn't among us, but I know businesses will want some comfort, if they can, that the co-funded payroll scheme is due to end at the end of August. Could we see an extension of that, Chief Minister, and could we see more support for businesses that are undoubtedly going to be hit by not having enough staff?
I think, let's be clear, we've supported business again, probably more significantly than a whole range of other jurisdictions have done. We will continue to do so if the need is there. It's too early to say what will happen to the co-funding payroll scheme beyond the 31st of August. But we will give sufficient warning if we feel it's appropriate, notices rather if we feel it appropriate, that it needs to be extended beyond that. Let's see what happens to the numbers. We're middle of July, so that's 6 weeks away. Let's see what those numbers look like over the next 2-3 weeks, and then we can assess. Okay.
Thank you. And the second question, your message to the outside world a few weeks ago that Jersey was very much open for business, come and stay. This is the place to be this summer. Is that still your message with these rising case numbers?
Yes, because we have got a very rigorous testing system. We are seeing where the infections are occurring. We're actually seeing it's consistent with what is happening elsewhere in the UK particularly, and you will note that France has also put some measures in. They're at a different stage in where they are in the profile, shall we say, of the pandemic, but they are also in a less good position from the vaccination process. So there's a whole balance again of issues, but certainly the message I've had almost without exception, I think, from any visitor that's come through, they have felt safe when they've been here. They've been very impressed with our testing regime that we have in place. And I think it's also for visitors to understand that one of the reasons, not the only reason, but one of the reasons our numbers are going up is because of the volume of testing we're doing. And that in itself does add, hopefully, to the safety for islanders and for visitors. And obviously what we have started doing is we've been recognising the status of doubly vaccinated people.
Thank you.
Okay.
If I had time for one more quick one,
You haven't asked any supplementaries,
No,
so
that's
we'll allow
very
you one.
true.
Okay.
I'm just last week you said that there were extra people being employed into contact tracing, 30.
Yep.
We also hear this week that they're still continuing to struggle. People are waiting hours to be contacted by them, either to be to ask for their direct contacts or whatever. Are there more people going to be employed into contact tracing to meet the demand?
I think the short answer to your response is, are we taking measures to make sure it improves? The short answer is yes. That we've got effectively an open recruitment system in there, i.e. we are continuing to recruit to get more people in. We're also putting more automation in. So what you should be finding is that if you are a direct contact, you will get a text with your appointment in to go and be tested. So that is taking manual labour out and making it automated, and therefore that in itself will help to reduce the pressure. There is more happening as we speak. The one plea I would make, actually, because it's come up a number of occasions in the last sort of 24, 48 hours, and we have said it previously, you're not a direct contact until contact tracing tell you you are. So in other words, just because a friend of yours rings you up and says, I think you are a direct contact, please don't ring the helpline in those circumstances. Obviously, if you're feeling unwell, please do. But if you're feeling fine and it's a friend of yours, somebody you know, has said, actually, I think you might be a direct contact, don't automatically assume you are. Contact tracing have a particular regime and program that they go through. The more people that ring up thinking, I know they're trying to be very helpful, thinking they're direct contacts but aren't, that sometimes causes the delays because that clogs up the system. So contact tracing will contact you if you are a direct contact. And I think that's one message to take away. Anything else to add?
I just remember there was a cohort of people being trained yesterday in the test and trace team. I think training's about 2 or 3 days, so they're coming on board at the end of this week. We're also open to school staff now in the school holidays who would be welcome to join the team. They've been approached. And students coming back on their summer holidays are also welcome to join the team. Thank you.
Okay. Thank you very much. Right, on that note, we will start drawing this to a close. So if I can just ask everyone watching, please remain calm. We remain in a good position. And whilst we are seeing more islanders with COVID vaccinations, the vaccinations are working, and more islanders are getting their vaccines every day. And we're seeing that symptoms generally remain mild, and islanders who are in hospital remain few. We are learning to live with COVID in our lives, and it is important during these slightly uncertain times that we stay the course and work together as a community to care for and protect each other. Our togetherness, combined with the vaccine, remains our best defence against the pandemic and will keep us safer this summer. And again, I want to thank all islanders for continuing to adhere to the guidance issued by public health officials and for your continued support in acting in the best interests of this island. Thank you all for listening. We'll draw this to a close.